Hi ladies and gentlemen, I'm Chen, ophthalmologist and glaucoma surgeon from Pantai Hospital. Today I would like to share everybody regarding glaucoma, the silent thief of sight. Glaucoma is a disease of the eye where the intraocular pressure have increased, causing uncontrolled and subsequently causing damage to the optic nerve of the eye. For primary glaucoma, the risk factor for it is aging, as well as more than 55 years old is a risk factor. Positive family history of glaucoma, as well as whether you have extreme farsightedness or extreme nearsightedness. For secondary glaucoma, it's due to other disease of the eye. For example, if uncontrolled and unmonitored use of steroid medication can cause steroid-induced glaucoma. For uveitic glaucoma, this is due to a chronic inflammation which subsequently causes the intraocular pressure to be increased. For rubeotic glaucoma, it's usually due to uncontrolled diabetes as well as blood vessels or vessels obstruction within the retina, and there's other subtypes of glaucoma as well. Most of glaucoma have no symptoms, means asymptomatic. That's why they call as the silent thief of sight. The vision and the visual field progressively getting narrow, and subsequently when you start to detect it, you have a tunnel vision. That is the late stage of glaucoma. However, for angle closure glaucoma, you will have sudden increase in intraocular pressure which cause red eye pain. To diagnose glaucoma, we have a series of examinations. First of all, we have a slit length examination just to check how about the structure or the anatomy of the eye. Subsequently, we need to check the intraocular pressure, which is the pressure of the eye. We have this sophisticated machine and technology to check the thickness of the nerve fiber layers, as well as we have a functional check which we're using this visual field function to see how much is the visual field of the eye. We have a few treatment modalities for glaucoma. We have these anti-glaucoma eye drops, which we have this eye drops medication to put inside the eye to reduce the intraocular pressure. The function of it is to reduce the production of fluid within the eye, or we increase the outflow of the water within the eye to reduce the intraocular pressure. Besides from that, we also have laser treatment, and at the end we have also surgery. There are a few surgery we can do. First of all, we can do a trabeculectomy where we do an alternative pathway channel throughout the sclera to increase the outflow of the fluid within the eye. We can doing this glaucoma drainage device, which is just a small tubes which are inserted into the eye surgically to increase the outflow. And we also have this small micro shunt where we can put with a small lumen within the tubes to increase the outflow. And for the latest technology, we have this micro shunt, or sometimes we also call as a minimum invasive glaucoma surgery, MIGS. Most of the time, MIGS is carried out together with cataract surgery. During the cataract surgery, this is less invasive and fast and less time consuming. As glaucoma progresses, the visual field will become tunnel and it progressively becomes smaller, and it becomes a tunnel vision. At end stage glaucoma, it may lead to blindness. As we know that glaucoma damage is non-reversible, prevention is better than cure. If you have risk factor, please go for early screening to detect any glaucoma changes. Start treatment early, prevent blindness.